Make it special. Make it Maloney.
This segment of the Port Jeff Pulse is brought to you by Holistic Body for You, health coaching by Karen Sullivan. Karen, I always love when we start a segment and that ferry's coming in. You know, the timing on that is really great, which means we've got some really good waves happening here with our guests.
Absolutely, yep.
Look at this. This is great. This is great. I've been waiting a long time to get a doctor.
I know.
I almost got hit by that ferry once.
You did?
Yes, I was in a little sunfish, and I was...
Are you serious?
Yeah, I was like 13 years old, and I heard a horn and looked over. It was about too close, way too close. I scared them a little bit.
He's born and raised here, so
Yeah.
Lovely.
he's got a lot of stories.
Yeah, it was a little sunfish
bet.
or something.
Yeah.
Well, thank God you survived that.
Yeah, exactly.
Thank you, Dr. Nenninger, for coming on the show. I'd like Karen to introduce you formally.
Oh, really?
Because you have a
Okay.
relationship.
Yeah, we do. Well, I had said before that Dr. Stephen Nenninger is a naturopathic physician located here in Port Jefferson. He is my personal physician, my family's physician, and him and I have been together now probably close to 10 years. He's been treating me, and it's been probably one of the most profound, amazing journeys that I've been on with my health. It's incredible. The things that I've learned.
Enlightening, right?
Yeah, it's been totally enlightening. Like, this man is, and I say it kind of jokingly, but this man saved my life. And I don't know where I would be if I didn't meet him when I did, which was now about almost 10 years ago.
Pressure on a Tuesday morning.
The funny thing is I can say the same thing because, I have stuff to teach my patients, but also there's people that teach me. And I think that any skills that I've developed this is my 21st year of practice.
God,
And
congratulations.
I've had over it's like over 7,000 patients.
Wow.
But what I've learned from Karen is just as much as what she says she's taught me. I mean, we've laughed, we've cried.
Oh, we've
butted heads, and even though she seems tiny, she can.
Oh yeah, she's got
horns. She can knock you out.
we could throw down.
You have chutzpah? Is that what it is? What do you
Yeah,
have?
a little bit.
Because
You have chutzpah plus.
Because it's stressful.
I'm a tough patient. I'm a tough patient. I'm not as compliant as I should be.
Maybe you're just wanting to verify and question and re-question.
Oh yeah.
Well,
Okay.
well,
Yes.
that's where she's helped teach me.
Yeah.
Karen Health has an extreme story, but so many people have thyroid problems. I mean, people lose 10% of their thyroid function every decade over 20. So by the time you're 50, 60, you've lost 30, 40, sometimes much more percent of your thyroid function. So Karen, having had thyroid cancer, had a quicker experience with that than most people. So when she came in, she was extremely out of balance because there was none of the regulatory systems in her body even existing that she needed to feel well.
Right.
Here's the first grade A question. What does a thyroid do? Or is it it's not a thyroid, right? It's a system, right?
No,
I'll let the doctor know.
Well, you have an organ in a gland. It's located, kind of sits around your larynx right here.
Okay.
And it's kind of shaped like a butterfly.
What's its purpose?
Well, I mean...
Well, the purpose is and of course Karen knows, but I'll answer
Yeah.
since I'm here and I
Right.
got my 10 minutes of fame. But, Karen is the thyroid coach for my practice too.
Okay.
So if I have someone that's working on a thyroid problem, we'll call in Karen because she's just lived it. And once you've lived something, you just have a higher level of expertise. We know in our own lives or knowing our kids or, you know what I mean? No
Right.
one knows them like you do.
Right.
So no one knows thyroid like Karen, even though I have some experience. And the main role of this gland is to regulate your metabolism, how fast the other cells are working. So how fast your liver processes toxins, how fast your body burns fat, how fast you think, how
Wow, it's an important gland then.
it controls everything.
Controls body temperature, mood, hair loss, constipation, I mean, it's
That's amazing.
And I always just when I talk to someone that's just going through this for the very first time, I say to them, you have to think of the thyroid as being a part of the orchestra. And think of it as like the string section. If you remove the string section, you're asking the orchestra to sound and perform exactly the same way that it did before. And that's what you do when you take the thyroid out of the picture. Because you're asking the body to perform and operate exactly the same way that it did, and it can't. It can. And that's why, you know, the vast majority of people that are probably out there have a thyroid imbalance. I mean, we talk about this all the time.
And another way of thinking about thyroid, even though we think about it as maintaining our metabolic rate, maintaining the thermostat that we're on.
Right.
Another way to look at it is like a circuit breaker. In other words, it's designed to shut your system down in times of stress. So if 5,000 years ago you're walking in the woods, you break your leg, you're not going to be able to get yourself calories. This circuit breaker snaps. It shuts your metabolism down until you can restore and reclaim your energy and reclaim your health. So the problem is for a lot of people that are highly sensitive, that circuit breaker flips off and they never reset it. Right. And if you happen to come from, for example, island nations like Ireland, people are very sensitive to having their thyroid triggered because those cultures have been through famine. So the ones that survived were the ones that could have that hair trigger shut down of metabolism. But unfortunately, there's a lot of things that can keep that thyroid switch from resetting, and some of them are just as the stresses that we faced in our life.
Is the thyroid exactly the same in a male and a female? Because I always seem to I think maybe I just hear, sort of just being out there, that I always hear about women in thyroids, and I almost never hear of men in thyroids. Is that any truth? It's
the exact same gland. The thing is that the thyroid is sensitive to estrogen. Okay. So the higher the estrogen, you can have lower thyroid function. So women are more commonly. But I treat a lot of guys in their 50s, 60s, 70s with thyroid problems.
Okay.
Very common.
Because as men age, they produce more estrogen, right?
That explains a lot.
That's exactly right.
So that's why come 50, 60, 70, they get softer, mushier, more sensitive, more emotional.
You're going to make me cry.
Plus, then it makes sense, right, for the thyroid. So.
But we've lived with thyroid disease our whole life in our family. My brother had what's called Hashimoto's thyroid disease, where you make antibodies to your own thyroid. He had that by 17, 18 years old.
Wow.
And he was misdiagnosed, and he went through a lifelong of, this is my older brother by 2 years, and lifelong of health problems, just never getting properly diagnosed with thyroid problems. So once I went to my naturopathic training, you know, he was on my mind, and we've been treating him for 20 years, and I take thyroid myself, and my sister does, and basically everyone in my family has some kind of thyroid dysfunction.
Wow.
So on your track, you noticed an issue. What came first? Your interface with the doctor?
No,
because of that? Or?
God, I wish.
Oh, okay.
I wish I knew about naturopathic medicine. I didn't. I was 29, and I was being treated allopathically and conventionally, going for, the normal sonograms, needle biopsies, all that stuff for my thyroid. It had been out of balance for many, many, many years. And finally, my doctor at the time, back then, had said, we need to remove it. And that's what they did. And, and they said that I had thyroid cancer.
Did the biopsy prove that?
That's what they said, But who knows?
Who knows, A?
If that's
and
really,
B,
I don't know.
As you know, it could be a part of that may have turned into something it may not have, right? It could be contained.
Yeah, and certainly once something's at the cancerous level, you don't play games. But our goal is if you have we say if you have a nodule, you have a problem.
Right.
So if you even have a tiny lump, sometimes very often it's wait and watch, because conventionally they don't want to do the surgeries.
Right.
We like to do whatever we can to treat that when it's super small, have it go away if at all possible, and then you don't have to worry about what's going to come next. And that's kind of the whole philosophy.
And nodules on the thyroid, just to piggyback on what Dr. Nenninger said, is that means there's an imbalance. It's the thyroid's way of saying, hello, something's going on here. So if you catch it early enough, you can reverse the effects and reverse the, as far as the low thyroid function that's in there. And in my practice so far, and I'm proud to say, I've saved 2 women from not having thyroid surgery.
Right.
And we've reversed that
that's
current
fantastic.
state that they were in.
So you're saying you did for them what you would have wished
Correct.
would happen for you,
100%.
if at all possible.
And that's why I do the work that I do.
But if this is such a regulatory gland, how did you function afterwards? What
Well,
takes place of that
I'm on
regulation?
thyroid medication
Gotcha.
now for the rest of my life. If I
Gotcha.
don't take it, I'll die. So I have to be on thyroid medication. But that's also really, really, really tricky. It's not it requires a lot of fine tuning and a lot of balancing, and it took us years to get to the point that we're at.
Well, the standard protocol is to use a T4 containing medicine, which is,
Right.
you may have heard, Synthroid and levothyroid. Those are the storage forms of thyroid. So they give them the storage form, trusting you're going to convert it to the active form. However, a lot of the stresses in life, just having high estrogen, emotional stress, physical stress, maybe something in the environment, maybe eating your food allergen, that can prevent you from converting the storage to the active. So a lot of women, in fact, I just had someone walk out of the office 15 minutes ago and said that for 10 years she was suffering extremely hypothyroidism. She was on a T4 medicine, but she needed the T3. And once she went on the T3, T4 medicine, she felt like the lights came on for the first time in 10 years.
And that was me. And Dr. Nenninger is the one that diagnosed that.
Pinpointed that.
10 years ago. Yep.
So 10 years ago, you started to eat differently?
Yes, I started to eat differently, but I also added in some additional thyroid support and additional thyroid medications because Dr. Nenninger diagnosed it immediately. As soon as he looked at me, looked at my blood work, he came up with the assessment as far as what was happening with me. And then I also I took out my food allergens and did Dr. Nenninger's food allergy test.
So this is huge. And this is
Yeah,
something you really
yeah.
don't find, as we all know here at this table, in a conventional doctor.
No.
Well, I think that...
I mean, they'll allude to it, but you're practicing it, is my point.
very often people ask me, students will call and they'll say, should I pursue naturopathic medicine as a career? That's the degree I got, which is there's 4 schools in the country. You get licensed, primary care in 15 states. And I say no. I think it's separating into 2 things. You either want to think of doing something like Karen does, which is a health coach on a specific field, like she specializes in thyroid and she's amazing at it, or you want to go into conventional medicine, because conventional medicine, they're smart people. They're adopting a lot of the things that are working now with natural medicine, and they've been working over the past 2 decades in my practice, because everyone wants to see people get better. So I would say you can't limit someone based on what they do or what their training is. Anyone who's open-minded and cares about their patients is going to start doing something like this. There's no reason like a conventional doctor can't have Karen come in as their thyroid health coach and have her work for them too.
Right.
So everyone's, it's not that common, but everyone's eyes are opening to this approach, I think.
But my point is, you wouldn't have normally heard the things you heard and gotten to the conclusions you got without visiting a naturopathic doctor.
No.
Probably.
Back then, we're going back 10 years ago. I think now there are some doctors out there that are kind of taking a much broader approach and looking at kind of creating their practice integratively.
Alternatives.
Yeah.
If you will.
Yeah, they are.
Now, three months ago, you had a scare. You didn't talk about it, and I don't know if you're prepared to talk about it today.
We
but
can.
you had something that went on that you said that you might talk about later. Did it
Yeah.
have to do with this?
Yeah.
Go ahead, you can talk.
Yeah, no. I had a cardiac scare. And Dr. Nenninger, again, we diagnosed it, and I came kind of unbalanced. And it was a combination of a few things. It was my thyroid medicine. It was my hormones, because I also do bioidentical hormone replacement therapy, which is natural replacement therapy, not synthetic.
You better say that again.
Bioidentical hormone replacement therapy. Yep.
Which just basically means putting the
Yeah.
same hormones in you that
Correct.
your body makes.
Okay.
And
Not putting a
men
Chevy
should
part-
be on. We'll do HRT. Men should do HRT as well. So it was my hormones, my thyroid medication, and also low iron. And what happened was my heart was just beating abnormal.
Palpitations.
Yeah, palpitations, slow, irregular, and Dr. Nenninger diagnosed that.
Well,
that-
it's scary anytime you have someone, and in this state, I only see people under my nutrition license, not my naturopathic license
Yep.
that I
Right.
have in Arizona, California, and Connecticut. But having known Karen as a friend for
Right.
10 years, I knew enough about her case to not overreact. Because I know if she went to some extreme measure, her body does not respond well to drugs. It never has.
No.
And she was going to get into some tailspin. So because she's patient and we have mutual trust, we were able to just tweak a couple things.
Right.
And she got back into balance, which
Right.
we're quite
Right.
happy with that.
Yeah. Yep.
Avoided some of the pitfalls that you can get
Yeah.
into.
Yeah.
So it wasn't something I did that made your heart.
No, this makes
Because
her
I've been
happy.
wondering ever since that day.
You made my heart pitter patter.
Not so much that.
No, this
glad
makes her
No.
happy. She's been talking to me about the show for a while. So
No.
I'm just glad I finally
Yeah.
made it down here.
Yep.
Oh, fantastic.
Yep.
So, in your practice, what do you like to do? What do you like to what makes you happy besides making a living in your practice?
Well,
Is this a case book study like Karen, or are there ones like that, or is it even
God, I
simpler
mean,
sometimes?
You have
I would-
hundreds.
I would say that it's more common than not now that I have more experience. I can look back on the cases I was not so happy with and see where I failed. So I'm happy about that. I always liked solving puzzles. Like if it probably wasn't medicine, which I got into for my own needs because I was so sick, I probably would have done something in math or physics.
Figuring
Yeah.
That's
something
what interests
out.
me. That's what interests me.
Do you
the
feel
equation.
comfortable sharing a little bit of that?
It's kind of boring, but yeah, I'm happy
It's
to
not
do it.
boring.
Okay.
It's
well,
not
Well, for
how this came about.
For me, in my early 20s, I became afflicted with colitis, which basically means you have to go to the bathroom a lot.
Yep.
And I had a really bad case. I'd have to go to the bathroom, 30 times during the day and 20 times at night. Now, not every time something would
Sure.
come out, but it was just constant urging, never sleeping. That went on for 7 years. I went to all the conventional, because to me a doctor I grew up with conventional medicine. I went up to Belterre and, got treated when I was sick. And so that was doctors to me. So finally I went to the greatest gastro guy that I could find, Park Avenue, leather-bound volumes, mahogany desk. I saw this guy, I sat down, and he looked at me for 5 minutes and he said, well, I can cure you. I'm going to cut out your colon and I'm going to put your life on drugs and you won't have to worry about this. And I don't know what I was thinking, but I got up, I turned around, I walked out. He's like, you'll be dead in 6 months if you don't do this. So I went to Port Jeff Library and I looked up an article and I looked up alternative and medicine. Now, I'd never heard the phrase alternative medicine. I just knew I needed alternative. I knew I needed some medicine. Talked about naturopathic doctors, go to a 4-year medical school, learn everything conventional, but learn everything about natural medicine. And I figured, let me give it a shot. There was none in New York State at the time. I drove 3 hours each way to Connecticut to see a guy. And at least I stopped getting worse. Now, he wasn't able to get me better. I spent about 2 years doing that, but I was not getting worse. And then I figured, I better go to school myself and see if I can figure this out.
Oh
so
my
that's
God.
what I went to naturopathic school
That's
for 4
fantastic.
years. Was sicker when I graduated than when I started, of course, after 4 years of 16-hour days. But at least I started treating patients and they started teaching me, I started teaching them, and I started figuring it out a little bit.
So did you figure it out? Did you cure yourself?
Yeah, I'm as healthy now as I've ever been in my
Okay.
entire life. Though to me, health is about freedom. So do I have ultimate freedom? No. Freedom really would be I could eat anything I want, whenever I want, and still feel good.
Gotcha.
So that's my goal. So I'm always trying to figure out it's always an experiment. What could I do to make my system less reactive to the environment and more supportive of freedom, where I don't have to even think about I can't eat eggs. So, do I have to worry about
Any
the
egg,
that
any
there's-
type of egg.
No.
Anything with eggs in it either.
No, in fact, my mom had, when I did the testing for her, we do the hidden food allergens, and she came back eggs too, so it runs in the family. She had 15 years of high blood pressure, went off eggs for 2 weeks, came back with normal blood pressure the first time
crazy?
in 20 years.
Yeah, that makes a lot of sense.
So
Yeah.
we're super reactive. My younger son has it, so. Yeah.
Right.
Did you figure out at least that everything you did have was physical, or was it nerve related? Could it even be here? I mean, because to have that, is it always just a physical aspect, or is it ever a mental aspect too?
It's a great question. I don't ever make it mental unless I've proven otherwise, because I can have someone come in the same person a month later, the same problems, the same taxes, the same spouse, the same kids, and their urinary tract feels better, their energy feels great. And so I always make it physical. Because the mental's so hard to, I mean, unless you have some deep-seated unresolved, you can always do a little therapy around that. I'm not against that. But I think a lot of times we tend to blame ourselves. Like, what am I doing to stress myself out that I'm making myself sick? Well, I went off eggs and, 2 months later, my symptoms were 80% better and I was still the same crazy person that I am. So...
So you must see in your practice a lot of people unnecessarily suffering, meaning they're home and they might even be immobile or think that, Jesus, I just don't feel good. And they don't even give themselves an opportunity to figure things out that you have now figured out.
Right.
Am I right? Because I think of my father and I think of that, to be very frank with you, he kind of just died just being immobile and full of inflammation and things that he didn't need to go through, really. Had he had a coach, somebody that I just, you know what I mean? He didn't die of a heart attack. He didn't die of, I know there's a medical term for what I'm looking for, but if people just knew that there was this road, and it's not immediate, to get back to wellness.
Well, it's out of the box thinking. It's out of the box healthcare. And that's kind of, that's what I do. I kind of help people kind of broaden their minds and kind of bring in
that this is a possibility.
Wider spectrum. Like, hey, have you thought of this? Hey, have you thought of that? Well, what about if we try this? What about if we try that? And that's where, I would refer to Dr. Nenninger and to the other physicians, that I work with around the area, because there are things that are way out of, that can be out of my scope where, Dr. Nenninger needs to come in and treat this particular case.
And you also refer to surgical doctors as well? All the time, I'm sure.
I have a lot of conventional colleagues. I wouldn't, when you have an expertise in something like that, my experience can't match it. I mean, they're seeing 1,000 brain tumors a year. I see maybe 5 a decade.
Right.
So I mean, respect for everyone's skill set.
But
I think is
your
essential.
specialty is almost the first stop to simply feeling better, just by changing some of your habits. That's what I'm hearing here, or your food habits.
Well,
in particular.
plugging the holes in the bucket is the way I say. You got a leaky bucket. You're not feeling good. That energy is draining out of it. At least fix the holes. Do a little food allergy panel. If you come back allergic to something, stop that. Then see what happens. See if the arthritis starts feeling better, or the depression or anxiety, especially with kids. I mean, I know Karen has a kid. She's several kids she's treating. And I mean, you can change the course of someone's life. I mean, what they even pick to study in school can be determined by a level of inflammation, because inflammation can affect your brain. There's chemicals that the body uses called cytokines that look like neurotransmitters. They look like brain chemicals. So once your body uses them, all of a sudden you're feeling differently about your career or your relationships or your town or your school or your family. And that's all due to inflammatory process going on in your body. So you could change life at the end. I mean, my mom has smoked for 60 years and she's had cancer 3 times, and every time we get her better. And the last time she had lymphoma diagnosed, and we treated it, and the guy said it was the first case of spontaneous remission of lymphoma he's seen in 20 years. So, I mean, that's my mom, so I can do that, and I can say, but there's amazing things that can happen. Older people, younger people, if you just pull that stress out of the system, take the weight off the camel's back.
Right.
Absolutely.
Right. Exactly.
So part of your referral process is getting a panel with the doctor?
Yes.
Right. Yeah, absolutely.
Yeah. Yes. Yeah. I mean, I really believe in the food allergy panel. I think it can really shed a lot of light on someone's health and kind of the state of their health in that moment. And it's a great place.
If it provides a base too, right?
Yeah. Yeah.
If you're eating your food allergens, you're not going to get better. So no matter what we do, and that's what I used to see in practice, which is why I look so hard for a good way to test it, because I'd treat 10 cases, 5 would get better, 5 would get worse, and I wouldn't know why. now I can clearly see, okay, this person's highly reactive to some food they're eating. Take that out, and then you get the good results.
That's amazing.
Yeah, and you know, I'm living proof of that. I mean, it's been one of, like I said, it's been one of the most profound, amazing journeys that I've been on, and quite honestly, I wouldn't have wanted it to be any differently, because, you know, like Dr. Nenninger said, it's given me the experience and, you know, and the insight as to now what I'm doing
Your
in
profession,
my
sure.
practice. Yeah,
Absolutely.
totally. Yep, absolutely,
Very cool.
absolutely.
Good subject.
I know. We could probably be here for days talking
You're welcome
about
to
this. It's incredible.
You're
so.
welcome to be. So anything you want to tell our audience in terms of, I mean, honestly, just if people are looking for solutions, or, you know, what's the next step? Because I know he's well known in town, but not everybody knows him. So
Right.
let's talk to the people that are seeing this for the first time.
Well, you know, I think that my practice is basically full, so which is, you know, that's really great. I'm honored by that.
You're blessed, yes.
But I know Karen is helping me help a lot of people and helping people herself. So I would just say I'm sure they can contact you through
Sure,
through the
of
website.
course.
Yeah.
Yeah.
Very important, because
Yeah.
honestly, we didn't realize that part of your service, and it's an important part, and
Yeah.
you lived it.
Right.
So what a
Yeah.
great segment to
Yeah.
be able to bring this out.
Of
honestly.
course. That's why I was really happy that you came on today.
I'm happy to be here.
Thank you, doctor. Thank you for coming
Thank you,
on.
Kevin.
We'll see you next time.
Okay, awesome.
Thank you, guys.
Thank you.
This segment of the Port Jeff Pulse is brought to you by Holistic Body for You, health coaching by Karen Sullivan. This segment of the Port Jeff Pulse is brought to you by Holistic Body for You, health coaching by Karen Sullivan.